Hi, I'm Detective Kunz with the Henrico Police.
And I'm Betsy Vick with Secours Forensic Nursing.
And today I'm participating in educating the public about suffocation and strangulation.
And we're going to discuss some of the facts and myths surrounding strangulation and suffocation.
A lot of times when I get to a scene, people assume strangulation, choking, and suffocation is the same thing. And then I have to go into explaining the vast difference among the three.
Right, it's definitely not the same thing. Because, as you know, with strangulation, it's an external force that's pressing on your neck, and it interrupts the blood flow and or oxygen flow to your brain. Where choking, it internally blocks your airway, and so it's like if you're eating a piece of chicken and it gets in your way, that's choking. And then suffocation, that is somebody could be covering your mouth and or nose or pressing on your chest to cause the suffocation. So they're three vastly different things, but a lot of people use them interchangeably.
I watch shows. I'm not going to name the shows, but I watch shows, and they drop that word often, but the victim was choked. The victim was choked. So I think it's just an easy go-to. I think they think it's the same thing. I think it's not deliberate where they're saying, I wasn't strangled, I was choked. I think they're thinking choking means the same thing. Because
Right.
they can't breathe. I can't breathe. I can't breathe, must be choking.
I definitely think that a lot of people just think it's interchangeable, and they don't understand until you spell it out and say choking is internal blockage of your airway as opposed to the external pressure on your airway or blood flow.
I find myself correcting people in my presence when they use it wrong.
Right. It is a little frustrating because choking is a medical problem, where strangulation is an intentional act.
When you're strangled, to come to terms with a violent act has been done to you. And if it doesn't add up to what you pictured that violent act to be, I think that's when it's hard to absorb. So
I definitely agree.
Going to a lighter term, or what they think a lighter term would be.
Right, because when you say I was strangled, you are admitting to yourself that somebody has intentionally done something to you that could ultimately kill you. And so that's a harsh reality for them, and it's scary. And so I think choking is an easier word to come to grips with.
I've had many victims that, at least initially, had no physical injuries, and explaining to them at the scene, we call the ambulance, let's go ahead and get you to the hospital now, based on the other symptoms. They just don't think, well, they expect, like on TV, right, the worst of the worst. They expect those big prints and all
Right.
that around their neck or up here, and that doesn't always ever really come to fruition, but if it does, it's a few days later.
Right, it can be. And so 50% of all strangulations, whether it's a fatal strangulation or non-fatal strangulation, have no visible findings at all. So you're not going to see the scratches, you're not going to see the bruises, the red marks. You won't see that in over 50% of strangulations. And so it's really important to encourage and advocate for our patients to come to the hospital to get a complete forensic medical exam, because we have additional testing and things that we can do to look at the structures of their neck to see if there's any hidden injuries or something that could in time become fatal for them. Because
The
there's
stroke, they're high,
Right.
higher, right?
So if you have an injury to your artery, you could have a stroke 6 to 8 months after the strangulation happened. And if you aren't aware of that and you don't get these tests done, you may not know, and then you could have a stroke that could potentially be fatal months from now. And so it's just, that's why we like to have everybody come to the hospital so that we can get them checked out and medically cleared.
I feel, I've had people say that I could, we have the symptoms checklist that officers tend to go by. And that's a few things we have to check to see, so we know how severe maybe something is.
Right.
But I find like the individuals, the victims, don't understand that just because they can be like, get off me or help, and they're having some sort of airflow. They're not understanding it's not really always the airflow, it's the blood.
Right, exactly. So strangulation is impeding the flow of oxygen and or blood flow. You could have no blood flow, but your oxygen is flowing. So that's why you can speak, that's why you can scream. You could have both. You could have blood flow, but no airflow. And so you can't speak, you can't talk, you cannot scream. And so that is where the myth comes from that, oh, well, I was able to scream, so I must not have been strangled. And that is absolutely not the truth.
I think it goes back to trauma, at least in my experience. Strangulation is a form of trauma. Suffocation is a form of trauma. I would never ask. The example I like to give is officers who are involved in some sort of traumatic event at work. It's physical, right? It's part of our job. I don't expect immediately when I come to a scene that officer can walk me through A to Z. They got to get past, their brain has to get past a certain amount of trauma. I find the same with victim strangulation, suffocation, not being able to tell me. I call it their experience from A to Z. It's just, that's not how it works.
It's not, because what we need to remember is strangulation is ultimately a traumatic brain injury, because when you're being strangled and you have the interruption of blood flow, there's the blood that's not getting to your brain, so you have cell death. So you're losing brain cells, literally, they're dying. Once they die, they don't come back. And so that is the definition of a traumatic brain injury. Add that to just the trauma of somebody being assaulted, possibly by a loved one, more times than not. All of that trauma going on with the traumatic brain injury, these patients do not have linear timelines. So they can't say, at this time this happened and then it proceeded to go on to this and that. They may be giving me a history and then 10 minutes later say, oh, I just remembered this happened, but this happened before that. That is completely normal, and that's what we expect of our patients, really.
I think there's two situations I think of with younger people, much younger than us.
Speak for yourself.
Is the mimicking of certain either martial arts or the whole wrestling thing. I think of the reverse chokehold concept and not understanding it doesn't take much but a little bit of squeeze, you are strangling your friend.
A chokehold is a strangulation.
Yes, it is a strangulation, hence form of deadly force, right? Then you have the flip side of it in terms of it becoming where young people, they're exploring sexuality, right? They're acting out and they're doing things that are strangulation. Thinking, oh, this is
the choking game,
the choking game,
choke
with
out,
that, choke
things
out,
like that.
That.
That's strangulation.
Safe word, things like that, but not understanding that's a danger. You're playing with your life. It's like
Right.
Russian roulette to me.
You're creating a traumatic brain injury. Every time you play the choking game, which, like we've talked about already, is not choking, it's strangulation, you're killing brain cells and you're not going to get those back. So you're creating a traumatic brain injury. It's not safe. That's how people die. It's accidental, but you can't consent to something that can kill you. It's not a game.
I think again the word choking came up, choking game or
Right.
chokehold. It's not a choke.
It's not a
That's
chokehold.
confusing already.
It's strangulation. I think that the challenges, that is what leads to everything. You know, people see it, they want to do it, they want to mimic it. And so that's where we are with social media.
And until somebody shows that they've gotten hurt trying it, everybody's just trying to get those followers and take the next level, top off. And yeah, the social media realm for sure, I feel like
Right.
it's immediately starting to dictate some behaviors that are very
Dangerous.
It's dangerous. It's
They're
just
dangerous.
Yeah.
And even if somebody does die, then they think, oh, well, I didn't die when I did it, so it's okay, they just did it wrong.
Right.
No, you got lucky because you didn't die. And, you know, but you do have side effects from it, you just don't realize it yet.
No.
Absolutely not.
I think it's very important to talk about what a healthy relationship looks like and focus on the positive. I've known many people that have been in non-violent relationships And then obviously with my job, I've seen the complete opposite and having to explain to a person that this is not okay.
Right.
I don't like the word even normal, but I need to let them know your daily normal is not okay.
No.
The rest of the world would absolutely agree that
Right.
that sort of behavior in any relationship, if anger gets that level, I mean, as far as I'm concerned, when somebody strangles somebody, they're trying to kill you, right? So how is that any different than the typical, like the term attempted murder?
Right.
They're
It's a
trying to
very
kill you.
intimate act because
intimate,
it's
violent act,
in
but-
your face with somebody's bare hands. Most of the time, you could use something else, but most of the time we see it as bare hands. But you can't have a relationship that's based on fear. And so that's what a lot of these relationships are. And I have one patient that I had years ago, and I will always remember. She was in her 20s, and I was just talking about what had happened, and then she was telling me about things when she was growing up. And so I just asked her, what made you want to talk to me today? And she said, I didn't know this wasn't normal because this is what I grew up with.
Right.
And so it was her normal. And I felt terrible for her, and it has stuck with me, and I don't think I will ever forget her because it didn't occur to me that it's somebody's normal.
Right.
You know,
Right.
because I've been lucky enough to be in healthy relationships, you know, growing up and as an adult. And so I think it's important to know it's okay. Life isn't perfect. There's no perfect relationship. And it's okay to disagree, but you have to learn how to disagree and how to work past things.
Right.
And once it gets to violence, that is never okay, and you need to get help.
I feel like there's red flags. I'm not saying there isn't moments where people go straight to strangulation and suffocation, but normally if they're in that kind of relationship, the domestic violence is already there.
Right.
There was other signs. It started
Control.
with the shuff, the control, isolating people from friends and family, but it doesn't usually jump to strangulation. I have used my hands or other means to intimidate you, breaking things along the wall, breaking the house,
Right.
shoving you, locking you in a closet or something like that. It didn't just all of a sudden
didn't
today
start
I
with that.
decided to just strangle my loved
Right.
one, right? Yeah.
Well, and control and isolation, that's not love. A lot of our younger patients, maybe teens, late teens, early 20s, think, oh, well, my partner just wants me, doesn't want me to go out with my friends, or doesn't want me to wear this or that. That's control, and that's isolation. You don't want somebody that is going to control and isolate you, because that is what abuse starts at. That is what abuse looks like. And so it's important to know that control is not love.
I think for everybody who has anyone in their life that they think this is happening to, be open-minded, let them have that conversation, give them a safe space to have that conversation. I'm obviously going to push at some point law enforcement. I know in Henrico County we train our officers very well of how we speak with a victim of violence, and there is no judgment. We are not here to judge. We're here to help and in the end get you whatever resources and help you need to be okay.
There's no judgment, and that's what we need everyone to know, that we have help. If you can reach out, there are people that would love to help and to guide you and to show you the way to get to a healthy place, a healthy relationship, and just let you know that you can get out of the situation.